One TV special report.
Atong pagtahod o pagyukbo sa atong mga opisyal sa DAKBAYAN sa OZAMIZ, headed by Mayor Attorney Henry Indiafo Aminal Jr., Vice Mayor Simplicia BEBIE NERI, the members of the OZAMIZ City Council, of course, ang atong resource persons this afternoon, of course, proper introductions will be done later, ang atong mga guests, facilitators, participants, and of course, co-LGU employees. The month of September is observed as the Prostate Cancer Awareness Month. So, health experts, health advocates all over the world observe the Prostate Cancer Awareness Month, September each year. To increase public awareness and understanding of prostate cancer, various agencies, specialty societies host a lineup of activities. And today, LGU OZAMIZ will be having a prostate cancer awareness symposium to give the public, including the LGU OZAMIZ family, the right information, which is the most important weapon we can have against prostate cancer, with the invocation to be led by Honorable Junjun Sakin and to be followed by the national anthem. We would like to request everyone to please rise.
Atong ipahilo na ang atong kagalingon sa bahal nga buhing presensya sa atong mabubuhat. Sa ngalan samahan ug sa anak o sa Dios Espiritu Santo. Amen. Ginoo, salamat sa kahaponon nga nagkatapo kini mo mga anak alang sa tumong ug katuyuan kalabot sa symposium, kalabot sa prostate cancer. Ginoo, kinahanglan kami sa mga balaang presensya. Kinahanglan kami sa imong kaalam ang mga speaker nga mohatag karong hapuna among makutlo kuno sa man ang ayan ng pagabuhaton, kuno sa man ang ayan ng pagalikayan. So ikaw ta magagiya kanamo karong hapuna, ikaw magpatiliwala sa matag usa kanamo. Kini makatabang sa matag usa nga mitambong karon ug among mapaambit ngadto sa uban. Kini tanan ang gipangayig pasalamatan pinagi ni Kristo nga among igsuon. Amen. Sa ngalan samahan ug sa anak ug Espiritu Santo. Amen.
We will now be hearing the opening message to be given to us by the Vice Mayor of OZAMIZ City. Let us all welcome her with a big round of applause, Vice Mayor Simplicia BEBIE NERI.
Maayong hapon kanatong tanan ug maayong pag-abot. First of all, I would like to inform you nga gusto gyud untang motambo ang atong mayor karon, but of no avail because he has a very important appointment in Manila. Equally, very important po kay it's an official function nga iyang giatinan dito. So, nanawag siya nako this morning nga, tita, ikaw lang palihog usaha. So, inana mo gina, imong sugo, akong sugot. Well, anyhow, this afternoon, we are so blessed because we have our guest this afternoon who is very expert on this particular activity. Well, in line with the celebration, the observance of our civil service month, we try to endeavor this program because we love our gentlemen. Palakpakan natong mga kalalakin-an, purposely for the gentlemen. Kay in consideration also nga, this month is a prostate cancer awareness month. Did I get it right, Doktora? Oh. Pero before I proceed, allow me first to greet our doctors here. Dr. Cheney Kaday, Dr. Maria FLORELYN YROG-YROG, Dr. Perlin NERI Machuca, wako kailan niya. Og labaw na gyud sa tanan to be introduced unya ang atong guest speaker who is very expert ni aning klasiha sa katalagman no, sa mga lalaki. Dr. John Mark Feliciano. Like what I said earlier, kinini ang gusto ra gyud sa atong mayor nga matambong siya karon. But anyhow, ni aming iyang mga backup. With us this afternoon, ang atong mga kinakusgan nga mga sakop sa konsiho. We have here the Committee on Health, Katlim, Honorable Katlim. The Vice Chair on Committee on Health, Honorable Lorly Fuentes Sepris. Honorable Cecil Co, Honorable Nini Linsag, Honorable Daniel Lau, Honorable Junjun Sakin. Wala ka nato karon diri hapuna ang usa ang ato majority floor leader kay he is out of town. Importante po kaayo for his check-up in Cebu. Pero gusto ra gyud taon to silang matambong karon. Well, anyhow, magpadayon ta sa atong ka-schedule na nga kalihukan. Then, niya nato ang kinakusgan pod nga doktor nato, Dr. Lorly Kalyaw. Salamat kaayo. Yes, like what I said earlier, we are so blessed. We have an expert no, nga maka-discuss with us this afternoon on this forum that we have now. This is in line with the celebration of our Civil Service Month. So we try to give focus, tagaan nato ng importansya kay, like what I said, palangga nato ang mga kalalakin-an. Palakpakan nato. So paminaw yung maayo, ha? To take care of yourself para nga makapadayon ta sa ato pagpangalagad dinhi sa ato ang institusyon sa panggamahanan nato dinhi sa syudad sa OZAMIZ nga with all the sound health and sound mind. So this afternoon, in behalf of our Honorable Mayor, Mayor Indi Uwaminal Jr., and of course the member of the Sangguniang Panglungsod, salamat kaayo sa inyong presensya. Your presence this afternoon speaks out that you care for yourself. Good afternoon.
Thank you very much, Vice. Okay, so sa ato anang gihisgotan ang atong programa karong hapuna, maghisgot kabahin sa public awareness sa prostate cancer. So kinahanglan nato masayran kung unsa ka grabe, unsa epekto sa publiko, pila nay namatay itungod sa prostate cancer. And to give us an update of deaths related to prostate cancer, let me give you our acting city health officer. Let us all welcome her with a big round of applause, Dr. Maria FLORELYN YROG-YROG.
Good afternoon, everyone. Akong pagtahod sa ato ang Mayor, Mayor Indi, sa ato ang Vice Mayor, Vice Baby NERI, sa ato ang mga city officials nga naakaron, sa mga colleagues nako, mga doctors, most especially sa ato ang guest speaker for today, og sa ako ang co-public servants, kitang tanan, mayong hapon sa tanan. Cancers are among the leading causes of morbidity and mortality worldwide. It is one of the 4 epidemic non-communicable diseases and lifestyle-related diseases, including cardiovascular diseases, diabetes mellitus, and chronic respiratory diseases. Among the cancers, prostate cancer is the 2nd most common cancer in men worldwide. In the Philippines, cancer is the 3rd leading cause of mortality after the diseases of the heart and vascular diseases. According to the latest WHO data published in 2020, prostate cancer in the Philippines reached 4.149 or 0.69% of total deaths, with death rate of 17.74 per 100,000 population, ranking Philippines in number 76 in the world. Among Filipino men, there are 6 most common sites of cancer diagnosed, as lung cancer being the top, followed by colorectal cancer. 3rd is the prostate cancer. 4th, liver cancer. 5th, gastric carcinoma and leukemia. In OZAMIZ City, from 2019, 2020, and 2021, cancer of all types remains top 3 leading cause of mortality, following pneumonia and cardiovascular diseases, then followed by cancers. In 2020, there were 69 total cancer cases here in OZAMIZ. 44 of these were men, and 2 of them had prostate cancer. In 2021, there were 58 total cancer cases here in OZAMIZ City. 20 of them were male, and 2 of these 20 had prostate cancers. And in 2022 up to present, there were already 59 total cancer cases in OZAMIZ City. 20 of them were male, and 20 of the male had 2 prostate cancers. So these numbers are mortality, mga patay sa OZAMIZ City due to cancer. So majority of these men with prostate cancer diagnosed at ages 59, being the youngest, to 84 years old being the oldest. Some of them died mainly because of the cancer itself, but others were because of various other causes, including external causes and heart failure, most especially with comorbidities. The exact cause of prostate cancer is unknown, but with early diagnosis and awareness, the key to beating prostate cancer is the time to prevent the disease and defeat prostate cancer. Daghang salamat.
Salamat kayo, Doc. Honorable Kat Lim will now introduce our resource speaker for this afternoon's symposium. Ato siyang pakpakan.
To our beloved City Mayor, Honorable Attorney Henry F. Waminal, sa amuang inahan, Vice Mayor Simplicia BEBIE NERI, my co-member of the Sangguniang Panglungsod, our Acting City Health Officer, Dr. Maria FLORELYN D. YROG-YROG, participants, visitors, ladies and gentlemen, good afternoon. According to Medical Bulletin on June 16, 2020, study shows that prostate cancer is one of the most common type of cancer among Filipino men. According to the Philippine Cancer Society, the annual mortality rate due to prostate cancer in the Philippines has increased by 122.5% since 1990, indicating an average of 5.3% a year. These incidents has been recognized by the Department of Health. To further increase public awareness and understanding of prostate cancer, it is my privilege to introduce to you our guest speaker. He pursued and finished his medical degree at Cebu Doctors College of Medicine and specialization on urology at Vicente Soto Memorial Medical Center in Cebu City. Co-owner and a urologic surgeon at Tobias Feliciano Faith General Hospital Incorporated. Diplomate, Philippine Board of Urology from January 24, 2021 to present. Fellow Philippine Urological Association from November 6, 2021 to present. After his residency at this top teaching training medical facility in the Philippines, he decided to come back home to serve his fellow OZAMIZ and co-males in neighboring provinces. As a co-owner of Tobias Feliciano Faith General Hospital Incorporated, he envisioned to reach out and bring awareness to the people about the male reproductive health care. Without further ado, ladies and gentlemen, please help me welcome a very proud OZAMIZ, a solid ASENSO supporter, Dr. John Mark S. Feliciano, for his discussion on prostate cancer. Thank you.
Hello, good afternoon, everyone. Thank you, Kat, for the introduction. Okay, this is just an informal lecture. No, I will make it as layman as possible, and later on you can ask me questions. No, just be comfortable. I admire kung medyo honest ang atong mga audience. You can ask me anything. No? So again, thank you for having me here to give the lecture, and I think it just shows that the LGU of OZAMIZ, headed by Mayor Indy, Waminal, and the rest of the Team ASENSO are giving an utmost importance to health. No? And sa tanan no, na-appreciate na ko ang istorya ni Vice Mayor Tita BEBIE NERI na pinanggaon na to atong mga amahan, because sila po'y nagsakripisyo sa atua uban sa atong inahan. So, can I start? So, again, this will be a lecture on sakit sa prostate. No? So, I will start with ang prostate naragyod sa lalaki. Okay, wala na siya sa babae. Okay? I think majority are enrolled kanang gitawag nilag Marites University, no? College of Chismis, no? Majority, no? So they will always say, nana say prostate, nana prostate. Tanan, lalaki na ay prostate. Okay? So, next slide, please. So, ano na makamoy problema sa pangihi? Kinsay na problema sa pangihi? Okay, very good. Very honest person. Okay. Next slide. Sige og pangihi. Daghan gyud. Very good. Perfect crowd. Kanang mapukaw ang asawa, magpirmig ihi-ihi sa gabi. Okay, mga asawa, you may also observe, no, your husbands if they are having the symptoms or na sila yung mga simptoma regarding this one. Next. So again, mapukaw, mabilar, no, magbular, magpagtrabaho sa the following day, medyo duka kay nag-iihi sa gabi. Lapas sa ikatulo. Next. Maglisod og pangihi. So mabantayan ninyo, magsunod mog pangihi, dugayan yan na humanoy. Dugay man kay to siya, dali. So maglisod nagpangihi compared to medyo bata-bata patagamay. Next please. Kalit-kalit og pirming kahion. Bago ra nangihi. Taod-taod, excuse me, mangihi ko. Ana. Next. Hinay ng agas sa tulo sa ihi. Di na kayo pre sa una nga magtanaw sa layo. Imbis magtanaw dito, magtanaw na lang sa sapatos. No? So kinsa may naigibati ana. Daghan nakarelate kay daghan ni-react, no? Alright, so next slide please. Putol-putol ang pagpangihi. Pag-ihi, mawala, ihi nasad. Again, this is an informal lecture. We can talk in Bisaya so that it will be more comfortable. No? Next, please. Kinahanglan mo utong aron mo gawas ang ihi. So I think most of the wives here, ma-notice ilang asawa, dugay mo kayo magawa sa CR, mag-ana sa bungbong. Nag-utong. Murag daghan ni react. So some of you are having these symptoms already. Next, paminaw ba nimo? For example, when you urinate, di ba, mangihi ka. After mangihi, humana, mulakaw na ka. Pag ihi nimo murag na mabilin, feeling nimo na mabilin. Then after a while, mo excuse na po ka sa meeting, mangihi na po. So, na-feeling nga mo rin na mabilin, nga ihi. Next, please. So, again, tingali ikaw na ay sakit sa prostate. Akong klaruhon, ang prostate naragyod sa lalaki. Wala na siya sa babae. Okay, so tingali na kay sakit sa prostate. So, again, if ma-remember ninyo, magputol-putol ang ihi. Pag ihi, mo rin na mabilin. Medyo hinay na ang lupad sa ihi. Ihi karon after a few minutes, excuse na sad because mangihi. So just remember those symptoms, no? So next please. So unsa ni ang prostate, just to give you a quick anatomy. So this is part of the genitourinary system. Again, this is part of a male genitourinary system. Nana siya sa kidney or riñon, ang ihi himuon din ha. And we all know that ang ihi is hugaw, di ba? So when it goes down to the ureter, sa tubo, sa agyanan sa ihi. Walay pointer, no? So it goes to the bladder or the pantog, and then munaog na siya padulong sa atong tintin, diretso mugawa sa ihi. Wala man siguro bata diri, no? We're all adults, no? Yeah, so it goes down to the tintin and then mangihi ka. Next slide. So those are the paired prostate glands. Duha na sila kabuk at bang right and the left. No, sa mga papa or lolo nga nagka-problema sa prostate na operahan, they always describe it as the right and the left lobe. So duha kabuk. So diha moagi ang ihi. So normally kusog na siya, dili kayo magputol-putol. Next please. Next. So there are three common or tulo ka sakit sa prostate nga common gyud sa tanan. Pagdako sa prostate, pagdako is always part of aging. As men age, again, walay dili tinuod ng ingon sa mga marites sa silingan nga overuse. So bagay na? Very good. Memorize yun. Og wala use. Very good. So that's, wala gina siya yung relationship, okay? Sa pagdako sa prostate. Udako gid ang prostate regardless kung overuse, underuse, wala use. I just want to make that clear, no? So pagdako, ang second is prostatitis. Kini mo'y dili necessarily overuse. It's always na timingan ka nga nag-infection na nakay nakahilawas kanang sex nga naay infection. That's why it's called paghubag. Sa Bisaya is paghubag. Dili pagdako sa prostate. Kay paghubag niya mubara na pud sa agianan. So almost the same symptoms. And lastly, which precisely why I'm here is because of prostate cancer. So, unsay mga komplikasyon kung madugayan o atiman ni mga problema ha? So, of course, ang ihi nga hugaw man dili kagawas, magbalik-balik ang infeksyon. Dili na normal sa lalaki mag-infeksyon sa ihi. Okay? Sa babae, yes, common. I think an OB-GYN is here because of anatomy. Pero sa lalaki, dili gyud na common mag-UTI ang lalaki. Next, of course, maglisod og ihi or worse, di na kaihi. Next, kung dako na kay ang prostate, naay usahay magdugo na ang ihi. But ang pagdugo sa ihi, dili permi nga tungod sa prostate. Pwede na siya bato, pwede po na siya cancer. So kung naay nang ihi og dugo diri, ayaw gyud na i-take lightly. Please have yourself checked. Get the laboratories, get everything, no? Kay serious na when manghihi kag dugo. Next is magbato sa pantog. Daghan ko na operahan ani diri sa Miss Ok. Tungod magpundo ang ihi, ganahan kay ang bato mo purma og bato sa bladder or pantog. Next, ang last complication is actually because ang ihi dapat mugawa sa mugawa sa lawas, dili kagawas tungod barado, mubalik sa kidney, definitely gubon ang kidney. Saka na ang creatinine. Next. So, this is how it looks like kung barado ang pantog. No? Imagine kung di ka kaihi for pila ka hours. Sakit kayo. Next. So we put a catheter. I think everyone is familiar with the Foley bag catheter. No? So we put a catheter to drain the urine. Next. So again, if nana mo ato nga symptoms, dapat magpakonsulta gyud kay para dili mo abot inani nga instead of isara ka problema, doble katulunan naguba ng kidney, napay bato, napay gitawag nga bulsa-bulsa or diverticulum. So again, because of the obstruction sa bara, nay bato ni porma, nay nagbulsa-bulsa, then ang ubang ihi ni balik. So maguba atong kidneys. Next. So, unsay buhaton, kinahanglan magpakonsulta, not necessarily a urologist, no? Dr. Kaday, Dr. YROG-YROG, Dr. Pearl Neri, si Ate Pearl. Any doctor can check you for prostate problems, no? So, very important, if nabot itong mga symptoms, you can have it checked by any doctor. And magpa-DRE, unsa maning DRE, it sounds very high-tech, digital rectal exam. Sa Bisaya pa, unsa na siya? Digital rectal exam. Murag mahalon paminaw, no? Pero sa Bisaya pa na siya, unsa na? Very good. So, yeah, basically, ang digital rectal exam is kuuton imulubot. Important kay nasa unahan ang prostate. May bawa na to if gahi, humok, or napay butoy-butoy. So, from there, magduda na tagamay nga cancer sa prostate, mas fast ma-detect. All doctors should do the digital rectal exam. So kung dili islamingon, ikaw na lang maingon, no? Dok, ingon si Dr. JM nga dapat jud kunin mo kuto na lubot. All male patients at the age of 50 years old. If na family history of prostate cancer, you get it at 45 years old. You do it at 45 years old. Next. So again, it's just putting your finger, no, in your lubot, and then you can feel the prostate more or less kung may lump, if it's hard, if it's rubbery, or if there are nodules or na mga butoy-butol, which makes you suspicious for prostate cancer. Next. Okay, that's how we do it, no? So dili na binuang kumingon sila mukuot og lubot. That's very serious. Especially urologists, it's a mortal sin for urologists not to do a digital rectal exam, or all doctors. All right. So next. So again, symptoms sa pasyente, kining IPSS scoring is very technical. It's more for the doctors, and of course, you do the digital rectal exam. But if ang pasyente dili gyud ganahan magpakuot og lubot for privacy, you can always do the ultrasound. That's why I think manotice niyo mga idara na lalaki appeal jud ang ultrasound sa prostate. Next. Again, dili tanan sa prostate tambalan even with a very big size. Now we always depend on the symptoms. Okay, not all dakong prostate nagbara because sometimes ang bara napadulong sa kilid, wala siya sa pasulod. So luag iyang you don't need to give any medications actually. So there are times nga obserbaran lang. Next. So we have the common medications. I think some of you are taking it. Tamsulosin, we have the alfuzosin, the terasusin. Kini sila mo ni siya mo paluag sa imong agyanan sa ihi. And kining ikaduha ka tambal, finasteride, dutasteride, mo ni sila mo pagamay sa prostate nga size. Na po yung mga combination, we have the DuDart, we have the Avodart. It's basically the same. Paluagon ninyong agyanan sa ihi o pagamyo ng prostate to avoid the complications. Okay, next please. So if di na gyud madala sa tambal, of course, tama gyud limit ang tambal, we maximize the medication kung mahimo di gyud mag-opera. We already have, we can do the surgery or sa Bisaya pa ka nang isapsap. They scrape the prostate, sapsapon, para mo luag ang agyanan sa ihi. Wala na hiwa, agi lang sa tintin. Of course, with anesthesia. Next. So, inani may tabo, no? So, may imagine niyo isapsap siya para muluag ang flow sa ihi. Next. So, again, prostatitis, this is a different disease. Muna ni siya ang pag-resulta sa panghilawas, not necessarily over sex, again, no, from what most people think, or you know, the neighbors, mga silingan, they always. So this is common in the young. Technically, di pa mudako ilang prostate at the age of 20 to 40 years old, but because nahubag, na-infected, munang nagbati-bati sila maglisod ihi. Okay, so this is how it will look like. Medyo muhubag, so nanapoy putol-putol sa ihi. So, usually, makuha gid ni siya sa through sexual intercourse or panghilawas. So now we go to the main topic, which is why I'm here. We go now to the most serious, as I think it was mentioned by Dr. YROG-YROG and Councilor Kat Lim. Prostate cancer, no? Medyo nanaghan yun sa karon panahon na. Next, please. So again, this was discussed already. It's part of the anatomy or part yun na siya sa lawas sa lalaki. Mutabang po na siya appeal sa content sa semen, sa similya. Next, please. So again, it's an abnormal or overgrowth of some of the tissues in the prostate gland. That's very true. Wala pa yung definite cause of prostate cancer. However, it is more common in the elderly, mga idaran. But again, nagkabata siya lately, among ma-diagnose, nagkabata ang prostate cancer. Very important, no? Karon after the lecture, please pangutana mo sa inyo, sa mga lalaki lang ha, pangutana mo sa inyong lolo, sa inyong tiyo, kanang direct gid ninyo, family history of prostate cancer. Very, very important for us physicians to know those things. Pangutana gid wala pa na-diagnose prostate cancer sa inyong pamilya. There are genetic factors, the BRCA2, the race, it's more common in the blacks, and most especially smoking. Kasi manigrilyo. So smoking, taas kayo nag-risk for prostate cancer and all cancers. Okay? So, of course, it decreases the risk factor when you do exercise and have a healthy living, generally speaking. Next, please. So, ang problema sa prostate cancer is, wala kayo na siya simptomas, murarag ni dako ang prostate. Magsugod na siyang simptoma kung nakakatag na. We have, basta advanced na, ayan na siya murag nakakagibati. So, of course, you have urination, blood in the urine, appeal po ang erectile dysfunction, and very common is kanang magsakit ng luyo. Smoker, elderly, sakit ang luyo, sakit ang gilid. Sometimes, dili na siya tungod bamaol. Sometimes, nikatag na ng prostate cancer. Next. So again, I think it was emphasized earlier, when found early, prostate cancer is one of the cancers with the highest cure rates. Ang goal basically for a urologist is kita tanan mo exit mangita, no? But as much as possible, dili because of prostate cancer. Because prostate cancer has the disease that has the most options. Most tambal, most options. We have surgery and everything I will discuss. So when you say early prostate cancer, it's confined or nara sa prostate. But if it's advanced, it's outside the prostate or nigawas na. So again, not everyone diagnosed with prostate cancer needs treatment. Nara po'y uban, mga batanon, we can just observe. So for the screening test, it's very simple. You can go to City Health, you can go to my clinic, you can go to any doctor in Marsgen. You can have a digital rectal exam. That's free, actually. That's part of your consultation. At least from there, dako nag-chance na magduda ta. You also get a PSA. I think some of you had this already, part of your annual screening. PSA is prostate-specific antigen. It's a blood test, sa dugo magkuha. Magduda na mangudenta kung taas ang PSA, although mo taas na siya glayang mga butang, pero kung taas ra kayo, magduda gyud ang prostate cancer. Labi na walay infection, walay recent sexual contact, no? So PSA should be part of your at least annual laboratories. Screening lang. Okay? Especially those with a family history of cancer sa prostate at the age of 45. Next, we have so we have CT scan, MRI, we have the PET scan in the bigger cities, we have the PET PSMA scan, PET CT, PET MRI, usually to monitor for recurrence. And I think kung nakadungog na mo, ang bone scan is basically to know if naabay ni katag sa bukog o wala. And of course, the biopsy. Okay, only the biopsy can diagnose prostate cancer. Even if your doctor will tell you, duda kung anak kay prostate cancer, it's still not prostate cancer unless naanay biopsy. So, again, the PSA is very important. It's a blood test. So, from there, makabaluta ko more or less nantay idea if naba kay risk for prostate cancer. Taas po niya kung magkadako ang prostate, magkadako po ang PSA level, na medicines or herbal or supplements na makataas sa PSA. Again, after the biopsy of the prostate, when you get the PSA, it's always, almost always elevated. Recent sexual intercourse and ejaculation, medyo mo taas po ng PSA. So when you get a PSA, please do abstinence 2 to 3 days before para di pud ma-alarm inyong urologist or inyong doctor or kamo mismo nga taas man akong PSA. Ma-alarm but actually, ikan mo nag-sex, no? Exercise, running, of course, bicycle, mag-bike, no? Next, please. So we have this here. I have this here. No, we do prostate biopsy. I always do ultrasound guided to para gid sigurado nga ang prostate ang maigo. So this is a simple procedure actually. In Bisaya, we call this kanang magkusi-kusion lang ang tissue and then i-send sa pathologist to know duha ra gyud cancer or dili cancer. And I think common misconception is when you do biopsy, mukatag ang cancer. That's not and never true for prostate cancer. All urologists worldwide, Manila, Cebu, abroad, we always do prostate biopsy to confirm the diagnosis. It's not true that when you do prostate biopsy, muna ilang common madunggan nga mukatag ang cancer. But from urology standpoint, we do biopsies even abroad. Next, again, it's the only test that can confirm. That's the only time the urologist will tell you you have prostate cancer. We can never tell you it's prostate cancer. Yes, we can tell you we're suspicious you have prostate cancer, but in reality, we cannot tell you unless it is confirmed by biopsy. Kaya naman ko po yung uban patients, no, daghan ko sa OZAMIZ, mahadlok magpa-biopsy. So, dili ka start a treatment kayo. So, complications of biopsy, we have infection, bleeding, and of course, pain. Next. So that's how we do it. We insert a probe, ultrasound, and we get a sample. Right, next please. So again, there are patients for observation. There are younger patients who are diagnosed with more than 10-year life expectancy. We can closely observe the prostate cancer. Of course, we are surgeons. We have the surgery as one of our options. If it's still confined, we can do radical prostatectomy to healthy patients. So removes all tissues surrounding the prostate and also the seminal vesicles, basically everything around it, plus the lymph nodes or the lusay-lusay. Kaya ang common man guna mo katag ang cancer sa lusay-lusay o sa buko. Next. Again, there are so many options for prostate cancer. We have the radiation therapy, the EBRT or external beam radiation therapy. A lot of things, no? IMRT, we have the proton beam radiation therapy, image guided, and the most common is the brachytherapy. It's a low dose. We put seeds, basically put seeds, or next slide please. Butangan sa seeds, and then the radiation is focused on the prostate. So there are so many options for prostate cancer. Next. We have the hormonal and chemotherapy. We have it here also. So again, diligid pa discourage when you're diagnosed with prostate cancer. Daghan kay options. Next. So in summary, prostate cancer is very common in the elderly. Well, dili sa din na nakadako akong kamot, no? So mayroon eh. So ayaw mo kahadlok, no? Prostate cancer is usually walay symptoms, wala kay bation unless late stage. It can be cured early if diagnosed early. And treatment is already available, whether here, Cebu, Manila. So have yourself checked regularly by your friendly urologist or any doctor for that matter, especially men 50-year-old and above. Okay, next. Thank you. So I think that would be all. Nakatug na mo. Napadayusa. Sorry. Okay, there's one more request. Okay, so mumatagi na mga tao after ani, no? So kung kaya, kisa'y nakakaya ani. Okay, so I think this is an additional lecture. No, this is not prostate cancer awareness. Next, please. So this is about erectile dysfunction, I think. No? So I think very important for the men. The small head is also as important as the big head. That's why it's neuro and uro. No? Next, please. So low erectile quality. No? So next, please. Next. So, kini, si Lolo, nagpasikat siya sa iyang asawa, pero actually, yara ng cane, yung sungkod. So, next.
One TV special report.